pain management is such an important part of medicine, and we are really grateful this morning. We've got Dr. Alan Dennis on the phone with us with Advanced Pain Care. Good morning to you, Dr. Dennis.
Good morning.
Thank you so much for being with us, and I know you're busy because you guys are seeing folks in a lot of different ways right now, but let's start first and foremost talking a little bit about how things have changed. You know, how has COVID-19 affected the way that you guys treat patients, and are you seeing new and existing patients at this time?
Yes, we are seeing new and existing patients. Through the end of March and into April, we were seeing primarily everybody via telemedicine. We're now working with a hybrid with that. Our primary concern with COVID-19 is making sure we do not get anybody sick. And we take a look at all of our patients, particularly those that have higher risk, and look at our risk stratification as to how serious it might be if they caught COVID-19, and take a balance of whether or not that patient still needs to be seen via telemedicine at home, or can we see them in face-to-face in the practice. Basically, I have to look at everybody as you may be a potential carrier of COVID-19, including ourselves, and making sure we're taking all precautions so that we not spread that virus.
I think it's fantastic that you guys have embraced telemedicine as well, because thank goodness that we have the ability to, see patients that way at this time. But I think it's great that you guys are able to see people safely now in the clinic as well. So let's talk about some of the precautions, actually, because I know you guys are being super duper safe. You're keeping everything really, really clean. Let's talk about for staff and patients, just kind of as they enter the clinic.
The first step in the process is as we are verifying the patient's appointments, there is a set of questionnaires that we're going to have to see if we need to adjust what we're doing, whether or not that patient needs to stay at home or not. Those questions are repeated when the patient arrives to just outside of the clinic. We take everybody's temperature before they can come in to make sure that nobody comes in with the temperature. Or if they come in and say, oh, have a family member at home that's COVID-19 positive, then we need to change and adjust things. Then we make sure that we have a fast track for that patient to go straight from the door to check in straight back to a room, so that there is not a congregation of patients within the waiting room. So that way we're able to keep patients 6 feet apart and continue to socially isolate our patients.
So let's talk about, some of the precautions that you guys are using as well for, if somebody has to come in for a procedure, because you guys have an entire list of people who can help with all sorts of things, neurologists, rheumatologists, that sort of thing. So if somebody has to come in for a procedure, what kind of precautions are you taking?
Ordinarily, we'd love to have our family members with us when they're going to come in for a procedure, but right now that is not a possibility. So we ask those family members to drop their patients off, and then we give them a call when they come back. We have slowed our rate of procedures to a degree during the day so that we can keep patients separated. So we can leave a pre-op bed that's empty in between each of the patients, so we can keep patients socially distanced from each other. We are copiously about washing our hands before and after each contact with the patient or their charts. Everybody, patients included, must have a mask before you come in the door. So we make sure we have that as well.
So many precautions, but I know you guys are doing it for the right reasons, and you're helping a lot of folks out with pain management, the sort of things that can really be debilitating in someone's life, and you guys kind of give them a new lease on life with all of the things you're able to help them with. So we appreciate you not only doing the good work, but of course being safe while you're doing it. Dr. Dennis, thank you so much for your time this morning.
It has been my pleasure. Have a great day.
You can call Advanced Pain Care at 512-244-4272 or go online at austinpaindoctor.com for even more details.